Welcome to the Moss Report. Hosted by Dr. Ralph W. Moss, his guest today is Dr. James S. Gordon.
Hi, this is Ralph Moss, and today I'd like to bring you a very special event, which is a video interview that I did with Dr. James S. Gordon, who's the author of the new book called The Transformation. And Dr. Gordon is an old friend of mine. I've known him for more than 25 years. He's a Harvard-educated psychiatrist who's internationally recognized for using self-awareness and self-care to heal people who are suffering from trauma. Both he and I agree that that often includes cancer patients. And so I've asked him to bring us the insights that he's gained in a lifetime of study of this topic and using this to treat people at the Center for Mind-Body Medicine in Washington, D.C., and also as a professor at Georgetown Medical School. Jim and I were both on the Alternative Medicine Program Advisory Council, and he was the head of the White House Commission on Complementary and Alternative Medicine Policy. So we want to do some further Skype interviews with leading figures in the field of cancer. Let us know what you think, and perhaps we'll make a series out of this. Okay, so for Moss Reports, this is Ralph Moss. Jim, I definitely want to focus our conversation today on your new book, but before we begin, I would just sort of like you to just inform our listeners how we came together 25, 30 years ago and what that significance of that was. So in other words, the history of the issue of the government's involvement in evaluation of alternative medicine.
Well, this has got to be a dialogue between us because I'm really interested in what you think we did. Well, we came together and initially in the advisory council to NIH, to the newborn Office of Alternative Medicine, which I remember in Joe Jacobs' wonderful phrase had a homeopathic level of funding.
Right, $2.2 million to run an entire office. Yeah,
but it was really exciting then because we were. Many of us didn't know each other at all, including we didn't know each other. And we got together on this council and we discovered all kinds of differences, but also all kinds of ways of, that we'd each been exploring in our own way, these much larger field of medicine than NIH was accustomed to even looking at or thinking about. And we were bringing in all these perspectives and kind of getting to know each other and wrestling with each other, even as we were trying to bring this perspective, which NIH was resisting, bring this sort of say to them, you got to look at this. This is important. This is important to tens or, maybe hundreds of millions of Americans, to a whole lot of people, ultimately to all of us. And we each brought our different areas of expertise and our different understanding to this, coming together to give advice, and it was really incredibly exciting and interesting and fun. I mean, it was fun and at times very frustrating because the office itself was resistant, was still very much in the grip of the conventional, way of looking at things, what Thomas Kuhn called normal science. Which is kind of a constricted version of biomedicine. We were saying, no, you've got to open things up. You've got to look at all these different possibilities. And, each of us had been exploring many of those possibilities, and we were bringing that perspective to the office. So it was really exciting, and I think the beginning of something very important. And of course, Tom Harkin was our champion. He was the one who made it happen.
Senator Harkin from Iowa.
Senator Tom Harkin from Iowa, who got interested in these approaches when Berkeley Bedell, who was a congressman, introduced them to him, and he saw the difference in his own life remember with bee pollen for allergies was the thing that got Tom really interested.
Right.
And then, of relevance to, one of the focuses, which was on cancer of our advisory council,
Yeah.
was when his brothers were having were coping with cancer, and there were various approaches, including acupuncture, which he was really amazed by, is that it could relieve very serious pain in one of his brothers. So Tom was kind of opening the way for us, and then inviting us in to
Yes.
to see what we could do.
You might be interested to know that within the past week, I had an hour-long conversation with Berkeley Bedell, who's 98. 98. And still going strong. His mind is as sharp as it ever was. So I think this is, I made so many lifelong friends on that committee and in that process. I still talk to Wayne Jonas frequently, and many other people who we were involved with at that time. So it was for me a very formative period in my life, and it was sort of the reality check in a way, because we all came from different struggles, different parts of the same conflict, or the same shift in mentality that was going on for a lot of people. But then we had to as you said, come up against people who were on the same side but had different histories and different perspectives. And I think we worked pretty well together, all in all. But
I think we did too. It was really, it was great.
but I think the frustration that I had, and that many people had, was that we we never really got to the the question of the evaluation of the burning issues, of many of the things that we wanted answers to, at least that a good portion of the engaged public wanted to have answers to. Certain treatments, do they work or do they not work? Is this something worth doing or something that's not worth doing? And whatever the reasons were, and there probably were a lot of factors on both sides, but we never reached any kind of satisfactory conclusion about the Brzezinski treatment, about the Gonzalez treatment, about Laetrile, about vitamins, high dose vitamin C. That seemed to be sort of beyond the reach of what we had available to us. And I'm not involved with the office with the center anymore, but I do look at the website, and I don't see any sign that you'd never know that those issues ever were a factor. But for a lot of people, including Berkeley Bedell, I think that was sort of the essence of what they were looking for ultimately out of the office. You agree with that?
I agree. I think what we did is we put these some of these trials on the agenda, and then we did get NCI to make. Ultimately NCI did do some investigations, however imperfect they were, and that was so. It's an ongoing. It seems to be an ongoing struggle.
Yeah.
Because they did the investigation of Gonzalez's work, but they
Right.
did it in a way. There's much dispute about whether or not the methodology was
Right.
could ever have yielded a valuable and valid
Right.
result.
Right.
So, I
Yeah.
think we pushed along the discussion, but there's still a long way to go. The other place where things have not gone far enough, that I felt just as much,
Mm-hmm.
is in looking at comprehensive treatments. That we're
Mm-hmm.
still looking at one single intervention. That's where the NIH focus is overwhelmingly, and not on comprehensive programs to deal with the chronic illnesses. So that's one part. And the other is we're not looking at the possibilities of health promotion, if you will, or what do we do? And obviously Berkeley Bedell's got some of those secrets himself. How do we live longer and better and less burdened by disease? And NIH has still stayed away from all three of those things, investigating some of the most controversial treatments, broadening its lens to look at comprehensive treatments, and looking at the power of self-care to not only as a treatment but also as a prevention of illness. So I think did our best to put all these things in play, but things change slowly. I think one thing though is, and so there's another whole other area that we have to look at now. And lots of people are calling themselves integrative, and they're bringing in treatments and therapies that were once considered alternative, and they're becoming more a part of mainstream treatment. And yet, it's still not as integrated in many ways as it should be. They're little centers that exist at the periphery, usually, of institutions, and often they're acting in similar ways to conventional medicine, and in some of the ways that we are concerned about in conventional medicine. They've become very formulaic and going by algorithms and not looking at the uniqueness and individuality of each person and spending the necessary time to get to know people and to work in partnership with people. So it's, each step we take forward, there are still others that we have to, other issues that we have to keep contending with.
And how do you
got things started?
We did. How do you deal with a situation where you want to do personalized medicine, but on the other hand, I saw an article the other day about telemedicine where they're talking about allocating 2 minutes to a consultation between a patient and a doctor. 2 minutes. So you're trained as a psychiatrist. I mean, could you do a 2 minute? I mean, the only 2 minute consultation you could do would be to write on a prescription pad a drug and maybe email that to a patient. I mean, what do you think about that development?
I mean, I think it's terrible, and I think this is part of what's making so many young people who are enthusiastic about medicine, part of what's making them discouraged about going into it as a career, because they're seeing that it's become very narrow, dehumanized, and formulaic. And there's not that rich connection with people, which is what brought me. I wanted to be helpful, and I wanted to be helpful in the context of one human working with other humans. I think this is terrible development. But Ralph, it's just an exaggeration of what's been going on already. Where the average visit in many of the sort of clinics and fancy private practices still is 10 or 12 minutes for a visit, which is it's no time at all. I mean, it may be time if you know someone well and they have an upper respiratory infection and they're doing fine in their life, but basically it's no way to work with people. So this is very, very damaging.
Yes. And so I want to talk about your book, your new book. When did the book come out yet, or is
book, The Transformation, Discovering Wholeness and Healing After Trauma, came out 5 days ago. 6 days ago.
Good,
6 days
good.
ago, September 10th. Yeah.
Terrific. And have you had good reaction to it so far?
Yeah, people who've read it, or because I sent out pre-publication copies to some people. People who've read it find it enormously useful, hopeful, because and what it does is it gives people who are overwhelmed by psychological trauma, whatever the source of it, whether it's childhood abuse or it's dealing with a cancer diagnosis or coming back from combat. It gives them a sense of, first of all, of hope that there is something, there are many things they can do. Second of all, it reminds them that they're not alone, that we're all going to suffer from some significant difficulties in our lives, if not early on, then later on. And third of all, it gives them a very clear and comprehensive path and a number of different practical approaches they can use to move through and beyond trauma.
Yeah.
And as you said when we began talking, to learn from and grow through even the most difficult experiences. So that's a long answer to a question about yes. People are saying yes. This is the book.
Yeah.
This is the book we were waiting for.
I read it and I think it's excellent. And I learned a lot about you from the book. It seems more personal than a lot of your other books. Did you intend it that way? Were you aware of that?
I didn't think about it, but other people who know me pretty well and have read the other books have said the same thing. So I guess I think it, maybe I don't know whether it's getting older or feeling easier.
Yeah.
or just sharing more because uh, the trauma effect has affected me in so many ways in my
Yeah.
life. Partly it's that, and
Yeah.
partly that I've been so immersed in it in terms of working all over the world with people who've been traumatized in various ways. So it's harder for me to distinguish myself from the subject I'm writing about. I'm the subject writing about a subject, and
It
it's my
seemed,
life as well as other people's.
it seemed, and I don't mean to get too personal, but like you're a person who had a very, I don't want to say privileged because that would sound derogatory, but certainly a very advantaged early life. Your father was a doctor, your grandfather was a doctor. You grew up in Manhattan, I assume not in the slums. So it's am I right?
You're right.
And I don't mean this in any derogatory
I
sense
understand.
whatsoever. Then when you got to Harvard, some things happened to you, and it was the tenor of the times, but you seem to almost like either accidentally or on purpose sort of find yourself in situations of incredible stress and distress. I mean, some of the stories that you told about your early years as a medical student and as a young physician are hard to read because they're describing situations with patients that are so painful. I I did read them and I appreciated the writing of them. They're very, very moving, but uh, it's hard to write about tragic events, even though there is sort of there is sort of a good aspect to them as well. But did you seek out? Was that something in your personality, or was this accidental? How did it happen? I mean, these formative events, or is it just that you're writing a book about trauma? And so, but almost like your entire career has been going to people who are traumatized and trying to heal them.
It's really interesting to hear your response because you're right. I think, when I was a privileged kid, there's no question. I grew up upper middle class in New York
Uh,
City. I didn't
uh,
have to worry about money. I grew up in a safe neighborhood. And I was very focused as a kid and through high school on achievement, being the best student, the best athlete. And then I got to Harvard as a 16-year-old freshman, and it was like my eyes started opening. And at first, they were opening to all these intellectual challenges and all these imaginative possibilities, and all my classmates who were, although Harvard was still pretty white at the time, still people from all over the country, all different, kinds of backgrounds. And I think what came out is something that was there in me from the time I was a little kid, which is a kind of sensitivity to and sympathy with other people that just was to some degree buried as I, sort of did my best to be the best student, the best athlete, did all these things. And then gradually in college, I was still, I was just kind of going my own way and reading English literature and hanging out and having a good time. But I was also very moved by people and events of the time. So the two events, I didn't even mention this in the book, that were very meaningful, two of the events in my freshman year were Fidel Castro coming to Harvard and seeing here's a guy who in many ways is like me. He's a middle class guy, liked sports, and he led a revolution. And at that point, it was it wasn't an authoritarian state. It was truly a revolutionary and open state. It was very exciting with all the possibilities. And I thought, change is really possible. And I was beginning to get some intimations of civil rights movement as well here in the United States. And this is 1959. And then Allen Ginsberg and Gregory Corso and Peter Orlovsky came to Harvard. And here were these totally disheveled guys, brilliant, funny, kind of this poetry that broke all the boundaries. And I was just very drawn to them. And I said, this is a kind of freedom of expression and a kind of uh, they could also see that they cared for each other in a way. They were very free with each other. So these things were important to me. And then, and I just in college, I really basically had a good time. When I got to medical school, though, It was a bit of a shock to me because college had been very free, very opening. In medical school, I could feel, it's kind of like a William Blake talking about the prison house. I could feel the walls closing in because the education was not imaginative. We could challenge, but the challenges were within a very narrow range. And I didn't know anything about other systems of healing or alternative medicine or anything. I just knew it didn't feel as free as college had felt. And then I really didn't like the way patients were treated when I was in the hospital. I thought it was very demeaning. And I could feel that that was painful.
How
So
did
I
you
think
survive that?
I survived. How did I survive? I had a great girlfriend. I used to go over to hitchhike over to Cambridge in the first year when I was living in Boston, and I would hang out with my old professor from college, and I'd be with friends, and I'd try to keep the life of the imagination going.
Yeah.
And I knew I wanted to. By the time I went to medical school, I knew I wanted to help other people. That was my identity. That as you said, my father was a doctor, and the best part of him, not always an easy man, the best part of him came out when he was with his patients. I never really knew I only knew my grandfather really through my mother's stories. But again, they were stories of somebody who selflessly devoted himself, who's a pediatrician, to his patients. So that was part of my identity. And it was just kind of opening up, starting with college and then with medical school, opening up to my own feelings, my own experience, and other people's as well. And I think the other thing, the other piece is I always liked the challenge. And so I did in some ways gravitate toward the people who were most in trouble, whether it was older people dying of in those sort of last stages of cancer on a hospital ward, or in my last year at Harvard Medical School, I worked with schizophrenic and autistic children. I wanted to go to that place that was most difficult, at least as a partner and imaginatively, and be with people and see, first of all, if I could be of help, and second of all, what I could learn. And so I think that's continued all the way through that I want to go to those places. And I think perhaps especially places where um, other people may feel less comfortable going. I want to kind of show that it's possible. I don't mean that I'm sort of, I want to tell the world right away that it's possible, but I want to see for myself. Is it possible? And what do I have to learn? I have a sense that those people have something very deep to touch me. And some of the people I write about in the book, and as you
Yeah.
say, their experience was very painful. They were incredibly powerful teachers for me.
Obviously, because so many years later, you're still thinking about them and writing about them. So most of the people who watch our vlog are cancer patients or related to cancer patients, and I'm wondering how you tie in your work with trauma and specifically with PTSD, post-traumatic stress disorder, to the cancer situation. I know, having gone through this now myself, I felt like I had PTSD after one encounter with a very famous um, university cancer center that will go unnamed, but that I had traveled 200 miles to try to get treatment, and was totally misdiagnosed and told basically my life was over by an irresponsible doctor who was probably just exhausted after, because I was the last patient of the week, and said and did some things that still, to a certain degree, haunt me, although it turned out to be completely untrue. And when I found myself back at my own alma mater, which is New York University, I got the right diagnosis and the right treatment. So everything's going well for me, but it's still, I still feel the pain of of being mishandled, and it was sort of an iatrogenic PTSD, although I don't mean to compare my situation to that of wounded warriors, but you know what I'm saying. There is a certain element, potential for trauma in the cancer situation, and it comes, I'd say, more from, it comes from other people. It doesn't necessarily come from just from the disease itself, because, you know, We understand we all can get sick, we all can have, even fatal illnesses, but how we're handled in that situation. So I'm wondering what advice you would have for other cancer patients who find themselves in that situation. How do you prevent that from happening? And if it does happen, how do you cope with it?
Oh yeah, no, as you're speaking, I can feel it, and I can remember so many people's experiences because you're absolutely right
Yeah,
that the diagnosis of cancer is itself traumatic,
yeah,
but the treatment, both the physical treatment and also the interpersonal treatment or lack of interpersonal
yeah,
attention or destructive words
yeah,
can be even more traumatic. And for
yeah,
many, many years, a significant part of my practice was with people who had cancer diagnoses, partly because they were looking, as you know, we worked together on the whole cancer guide, our cancer conferences and training
right,
cancer guides.
yes,
Everybody, my understanding still is that everybody who has cancer needs somebody who has the diagnosis, needs somebody there with them to help them navigate this difficult situation.
yeah,
And I think that, that's the one piece, and we can talk more about that. On the other side, the education of oncologists, unfortunately, is very limited in the human or interpersonal side of how to really understand the impact. I think what they tend to do is they tend to protect themselves from the emotional implications because it's so painful to be working with people who are, whose lives are in danger. So they shut off. And in that shutting off, not everybody, some oncologists are amazing humans. I remember in medical school, some of the pediatric oncologists, particularly, with such beautiful souls. Um, but too many of them shut off, and so they say things that are incredibly stupid and insensitive to people. And they don't understand the power of their words. The power of physicians' words, especially with somebody with a diagnosis like cancer, is so overwhelming. And because we're in a vulnerable state when we either have that diagnosis or fear we might have it, and it's like we're in an open, almost hypnotic state. And the words go in very powerfully. And the sort of estimates or tentative diagnoses feel like commands or sentences, judicial sentences. So we need support. And I think that's the first thing I want to say, that uh, if you believe you have cancer from the very first, it's really important to have somebody else there with you to help you navigate the situation, to help you ask the questions, and also somebody whom you can talk to honestly. And you can say, I'm terrified by what this doctor said, or I don't understand. And not only after the meeting with the doctor, but during the meeting to ask the hard questions and to challenge the misstatements or the unclear statements that are made. Because when statements are unclear, and we're scared, we often tend to put the worst interpretation on it because we're in a state of fight or flight. And in a state of fight or flight, when we have that diagnosis, just as
yeah,
other people who are traumatized, we're in a state of fight or flight, and our brains are not working so well. We're just
yes,
in fear and maybe in anger, and we react. And we need to, first of all, understand that that's the state we're in. We
yes,
need to have support, and the other things are that the techniques that I teach, I think, are really important, like the meditation, the slow, deep breathing. Before you go to see your oncologist, you really need to take some minutes and get into as balanced a state as you can, so you're not completely overwhelmed by what you hear, and so that you can bring your mind, your kind of thoughtful, critical mind, into play to ask the questions you need to ask. So I would say that the everything that I suggest in the transformation, the whole program that I use with people who and teach to people who've been traumatized by wars or childhood abuse or climate-related disasters, same sort of menu of approaches and techniques is one that's totally appropriate as you begin to deal with the diagnosis of cancer. You need to put yourself into balance. with slow, deep, and I teach slow, deep, soft belly breathing. You need to keep moving your body, partly because physical exercise is very good for dealing with stress, partly because it enhances immunity, and partly because if you move and you move freely with your body as well as exercising, you get rid of some of the tension that you
And
store.
you do describe these techniques in your book.
Yeah, describe the techniques in detail in the book.
Yes.
One I'm thinking about now is shaking the body and then allowing yourself to dance. Techniques that may seem a little weird at first, but
Uh-huh.
that you feel better from, more energized from.
Yeah. And are there good scientific studies to support the use of these techniques in cancer or in other diseases?
The studies on quiet meditation are very good. I mean, it's clear that sitting quietly, breathing deeply, or doing some kind of quiet mindfulness meditation on a regular basis, it changes not only the functioning but the structure of our brain. So that you can rebuild parts of the frontal cortex, for example, that have been damaged by trauma and stress, rebuild tissue in the hippocampus, which is responsible for significant aspects of memory and also for mediating the stress response. You can decrease activity in the amygdala, which is a center for fear and anger. And all of those, of course, feed into the hypothalamus, which is a central switching station, which improves immune functioning. So there are plenty of studies, for example, uh, on meditation and improving immune functioning. Plenty of studies on meditation improving sleep, which is also important
Yeah.
to cancer. And
You
there's
said you
studies. I'm
excuse
sorry.
me, but you said in the book people who are more hopeful live longer. Are there is it possible to study something like that? I mean,
Well,
hopefulness,
yeah,
etc.
the some of the interesting that's something that we looked at. Remember the study by Everson and Cole on spontaneous remission, where
Yes.
they studied case records. This is back in what, in the
50s,
70s, 60s.
50s or 60s, yes.
Yeah, they studied people, almost all of whom were had cancer diagnoses, who lived much longer than anyone predicted. These are people that studied at National Cancer Institute and other places. And then there was a follow up. There was a wonderful book called Remarkable Recovery, which looked at 2,000 cases in
Yeah.
the medical literature, most of whom were people with cancer who lived way beyond the diagnoses that their doctors gave them.
Yeah.
And one of the central qualities of those people is that they were hopeful, is that when the doctor gave them a grim prognosis, they challenged it. Maybe they challenged it directly with the doctor, and if not, in their own minds, they said to themselves something like, well, that may be what the statistics show, but I'm going to be one of those people who lives much longer. So hope is enormously important. Those people who are hopeful are likely to live longer.
So
That's
is there such a thing as false hope? I mean, we get this thrown
well,
at us all the time.
I think there's false hope is when people lie to you. Can you believe their lies? That's false hope.
Uh-huh.
The hope that you generate, that's yours. And who's to say if it's true or false? It's something that you'll find out about. I think the problem is one of the things that often happens with cancer, and this to some degree is false hope, is that oncologists, and remember Bill Fair telling the story, who was head of urology at Memorial Sloan Kettering, when he'd had I don't remember the exact data, but he had a couple of bouts with colon cancer, and there was another recurrence, and he went to his oncologist, and the oncologist said, "I'm going to give you X chemotherapy," and Bill, who knew the literature really well, said, "Well, there's no real chance that it's going to make any difference." And the oncologist said, "Well, I want to do something to help you."
Yes.
So, the oncologist was trying to help his colleague and friend, but that was a kind of false hope because he was
That's
giving something that was going to cause significant side effects
yeah.
that even he didn't believe was really going to make a difference.
Right. And
So I think,
we had an incident in this country that lasted 15 years. It was called high dose chemotherapy for breast cancer. And Robert Reddick wrote a book about this 15-year I call it episode, but this era, 15 years of giving bone marrow transplantation with high dose chemo, didn't work. It didn't work. And the name of the book was False Hope. So False Hope, that particular sword cuts both ways. The complementary medicine field gets criticized for raising false hope, but we know that there was wholesale selling of chemo, high dose chemo with bone marrow transplant that affected more than 40,000 women in the United States. And the person who wrote the most scholarly book on the topic summarized that as false hope. So it's somebody else's belief is the false hope. Your belief is the true hope, right? The correct hope.
Yeah, and I think what you need to do is look at what might be possible. One of the techniques that we use and that I've found very helpful with people with cancer is right at the beginning of working with them, I have them do 3 drawings. And I describe this in the transformation. They draw themselves after they get over a little self-consciousness about drawing. And then they draw themselves with their biggest problem, and they draw themselves with their problem solved. And one of the interesting things in working with people with cancer is the biggest problem is not always the cancer. And I tell one story in the book of a woman who had ovarian cancer, who drew this red blob in her belly. And I looked at her and I said, "What's that?" Thinking, "What's the ovarian cancer?" She said, "That's my anger at my husband. I've been so angry at him for so long." And the the solution to her problem was sitting opposite her husband and dealing with him. And she went into therapy with her husband. That's what she needed to do.
Yeah.
Now, that's what she needed to do to help herself as a human being. And hopefully, as you get more into balance and deal with the various issues that you have in your life, all that can do is be beneficial as you deal with the cancer. Other times, people with cancer doing those drawings will help them see what kind of therapy they're looking for, or may help them when they're looking for hope. The oncologist they've first seen maybe nowhere in the picture. There may be somebody else whom they've heard about, whom they're interested in going to see. So what this does is it mobilizes our imagination to find out possible solutions and mobilizes our hope to see that there may be solutions. And as people keep doing these drawings, as for example, as they continue to go through cancer treatment, the drawings change and other issues come up, and then other sources of hope become visible right there on the page. So I
Yeah.
think it's really helping people mobilize their own hope, and
Yeah.
that will that's the truest guide to which direction to go. And you need the information, you need a good understanding, the kind of understanding that you provide when you give people, well, here's what it says in the literature about this. But then people need to make their own decisions. And in my work with people with cancer over the years, it's been so important for them that, my doctor says this, my husband says this, but this is what the way I want to go. And people, we know the people who make choices that are in harmony with who they are, they make better choices, they feel better. And in general, the research hasn't been explicitly done on cancer, but it's done in many that I know of, but it's been done just generally. People who make choices that conform with their whole view of the world, their whole view of themselves, are likely to live longer and less likely to become ill than those who, are trying to please other people and doing what they think they should do. And it's a whole
Yeah.
and it's a whole matter. And I think it's really important. This is what happens with cancer, or can happen, is we can actually get more of a sense of who we are and what's really important to us, both in the treatment for the cancer, but what's really important in our own lives. And then we can move in that direction.
Well, thank you. The book is Transformation. Is the subtitle to the book?
Discovering wholeness and healing after trauma.
Fantastic. Publisher Simon and Schuster.
No, the publisher is Harper One.
Harper
It's
One.
James S. Gordon, MD, Harper One,
Right.
The
Well,
Transformation. So it's
it's
just
a
just
it's a
out. It's in bookstores, and
fantastic. It's fantastic. I hope everybody who's watching this will go out and buy a copy and read it. It's a great work, Jim, and a great pleasure talking to you as always.
Thank you, Ralph. And I just
Okay.
started your book, and I'm starting to get into it, and
Okay.
I'm fascinated by it.
Okay. We'll talk soon. Thank you.
Okay, great.
Have a great week.
Thank you for listening to The Moss Report. Visit our website at themossreport.com and subscribe for new episodes straight to your inbox. For your cancer treatment options and phone consultations with Dr. Moss, please visit mossreports.com.